On behalf of the People Centre, a very warm welcome to our World Mental Health Community Day. And it's a day to raise awareness of mental health issues and highlight the services available to you in the community in Belgrave, Spinney Hill and Leicester. And we welcome our voluntary community partners hosting stands who you'll hear from later. This year's theme for World Mental Health Day, as you've heard, is It's Time to Prioritise Mental Health in the Workplace. And the presentations today will address mental health in your own workplace, whether that be your organisation, the home, or within our communities. At People Centre, we're working to develop a health and wellbeing hub for the community, working with the NHS, our voluntary sector partners, and also our gym partners, and you'll see later on that. The People Centre started the People Health Group in 2020 in the midst of COVID to support the community. When COVID became rampant, we quickly got into gear, prepared and distributed over 100,000 meals to the vulnerable, nurses and key workers, and later we proudly became a much needed COVID vaccination hub, and maybe some of you visited here for your vaccination. At this time, we also started a series of online health programs ranging from nutrition, heart health, diabetes and exercise to help when we were confined in our homes, which really seems such a long time ago now. During the pandemic, we were acutely aware of the disproportionate effects of COVID on South Asians, and so we commissioned some research with a mental health group called CAREIF to understand the reasons why, and importantly look for solutions on how to help improve mental health. The findings are summarised in the report Improving Mental Health of South Asian Populations. So this is the report, and there's copies available on the back. Just summarising from the report, mental health issues are very much on the rise amongst the South Asian communities, with women particularly reporting high levels of anxiety, depression, suicidal thoughts and self-harm. And also older men reporting high levels of anxiety and stress compared to the white British communities. The report findings show how South Asians living in the UK have more risk factors for developing mental health. The main reasons, which you may be able to relate to, include our migration from South Asian subcontinent. Some 8 countries make up 4% of the South Asian population, and that's more than 2.5 million people with different cultures, languages and faiths. So a one-size-fits-all approach developed for the host community doesn't actually work for all. The pressure to acculturate. We try to fit with the majority culture, and this can bring about anxiety and stress. Racism. It's faced in a lot of places, such as in the workplace, and can hugely affect our mental health and well-being. And then financial struggles, often complicated by social inadequacies such as poor housing, overcrowding and unemployment. And then there is the physical health. And South Asians typically have higher rates of heart disease and diabetes, as I'm sure you're aware. So why do South Asians not readily use the mental health services? First, we have our cultural perceptions around mental health. Stigma and shame is the largest barrier as to why help is not sought. As a community, we shy away from recognising mental health issues. Negative descriptors like pagal, don't help, and a diagnosis can bring shame to the family honour. There is also a lack of knowledge and awareness around the symptoms of mental health. Anxiety, stress, depression, can't cope, feeling vulnerable can be symptoms of adverse mental health, but we may not recognise those. Language barriers are a challenge. Literacy is an issue, and this is now especially difficult for those facing additional barriers such as unfamiliarity with systems or lack of IT skills, such as making appointments online, which is what we have to do now. Also, many individuals are unaware of the available new services such as mental health practitioners in the GP surgery and social prescribers as well in the GP surgery. And there is also a level of distrust of mental health professionals, and data for South Asians shows a 9% increase in compulsory inpatient hospital treatment, and that South Asians are more likely to be prescribed medication than other interventions like talk therapy. So fearful for this, is it better not to report? This situation leaves many of our South Asian people vulnerable and even more isolated. People Health have developed a 5-year plan from 2022 through to 2027, looking at addressing the risk factors and barriers causing mental health issues. In the interest of time, I'm just going to focus on what we are working on today, which is Digit 2, co-development of mental health services. So this is services with input from the community, for the community, and available locally in your neighbourhood. The NHS Neighbourhood Mental Health Cafe is a recent service with over 20 running in Leicestershire. We run the People Mental Health Cafe here at the People Centre, and this is a free, safe, drop-in service for anyone experiencing mental health concerns, for confidential conversations and signposting on for support and recovery. And we have Gujarati, Hindi, Punjabi and Urdu speakers. We've seen a wide-ranging and complex number of cases, including anxiety, stress, depression, all sorts of abuse, suicidal tendencies and financial issues, for example. Also, the community just want to come in and talk because they are feeling anxious and stressed. The cafes are a way of providing early intervention for our community's mental health issues and can help take pressure off the A&E and GPs. Just to give one example of how we recently helped a senior couple with their permission to talk about this. Mr. and Mrs. S came in for support. They have a 30-year-old son who has autism and is living in with them. He spends most of his time playing games on his computer in his bedroom and likely has gaming addiction. Mrs. S, a non-English speaker, is the main caregiver for both her husband, who is registered blind, and for the son. The son is frustrated and takes this out on Mrs. S and has been verbally and more recently physically abusive. They have tried to see their GP but find it difficult to make appointments. Mr. S, because of his poor sight, is struggling around the house. Mrs. S is tired and needs help and support. At the cafe, we were able to get a GP appointment on the day for Mrs. S to report what was happening and seek advice and support. We also were able to refer Mr. and Mrs. S to the social prescriber at the surgery and ask for a referral for the son to a mental health practitioner in the surgery for gaming addiction and further mental health support. Social prescribers are a relatively new GP-based service for the community and can work with clients to identify issues and create a personalised plan to address their needs. We hope things are improving for them. Do speak to our mental health cafe staff, the lovely Maya sitting on our stand at the back, Piki Raj, Shabana here, and Aisha Jagat. She is our NHS lead and is somewhere here who can tell, here she is, and can tell you more about this really amazing service that the NHS have now supported. Really wrapping up, at People Centre, we recognise that health and mental health is an absolute must for thriving communities, and we need to encourage more open discussions on our mental health with friends, with family, with colleagues, so that we can get the right support for our mental health. Thank you. I have the pleasure today of introducing our keynote speaker, Dr. Fabida Arya, who's travelled up from Birmingham. A little bit about Dr. Arya. She is a consultant psychiatrist and executive medical director at Birmingham and Solihull Mental Health Foundation NHS Trust. She is a fellow at the Royal College of Psychiatrists and holds the role of chair of the Transcultural Psychiatric Special Interest Group and specialist advisor for the MTI scheme. She's also the General Secretary of the charity British Indian Psychiatry Association. Notably, and this is fantastic, Dr. Arya was awarded Psychiatrist of the Year by the Royal College of Psychiatrists in 2023, and she's passionate about reducing inequalities and improving mental health outcomes for everyone. So ladies and gentlemen, Dr. Fabida Arya.
Thank you very much. Thank you so much for inviting me. It's such a pleasure to be here with all of you, and some of you know that I worked in Leicester for 13 and a half years before moving to the Birmingham Trust 2 years ago, so it's a place very close to my heart. I've been to the People Centre for many years. I've seen many of my patients here, and I know the wonderful work it's done before, and I think Santosh and team have done even better in the last few years, so I'm really privileged to be here today. Even though I am giving this talk, all of you are going to participate in a few activities, so I would like you to be ready. So I'd like to talk about how we need to prioritize our mental health, because it affects everything that we do, and doing that makes everyone else better as well when we start looking after our own mental health. So I just thought I'll spend a little time saying how common are mental health problems in England. So in a 2014, to actually go out in the communities, and the good news is that there's a lot of support for this. People are asking us, can you train us? Students are calling us. The Royal College of Psychiatrists are very supportive. So I think the change is happening, and we need all of your help. We need to explain to mental health professionals about our culture, and no two people's culture is the same. So what is my culture? It's very difficult to put it into one box. I belong to so many cultures, and I belong to so many places, and unless my doctor or nurse or health professional actually takes the time to understand and ask me, how does this work for you and how does that work for you? What are your beliefs? What are your thoughts? How do you feel things? No one can really know me. Just because I'm brown doesn't mean I think like everybody, and you can't be put in different boxes. Usually when I go to communities, it's the Leicester community that told me many years ago that stop telling us we're hard to reach, we're easy to ignore. And recently the communities in Birmingham have told me that we are invisible. You don't, look at us. It's almost like we're invisible. We are a second-class community. And these are very painful to hear, but that's how people are feeling. We also have to be more proactive, and families, friends, we don't use advocacy services enough. So one of the things we developed in my trust in Birmingham and Solihull is culturally appropriate advocacy services, so that people from that culture can really speak for that person who have mental health problems and can't speak for themselves. And don't think that people like me who are doctors are experts. You are the expert on yourself, you are the expert on your loved one. And the decisions are not for the doctor to make, it's for us to make jointly. And a lot of people think the doctor said this, I have to do it. We have to question, why are you prescribing me this medication? What are the side effects? How is it going to affect me? And the more we do that, the doctors do the right thing as well. A lot of people struggle in silence, suffer in silence, and don't get help early, especially with mental health. If you do it quickly, it won't get serious. If you ask for help today, you can avoid somebody being admitted, going to crisis, and we have to fight that stigma. We have to come together as a community. And all of us are human. It's only normal to have emotions, and we have to keep talking. And in 2017, the World Health Organization did a campaign called the Let's Talk campaign, which was really positive. So, how families and carers can help? Usually when someone has especially serious mental illness, it's not the person who's suffering that sees it. It's the families, the carers, the friends say something's different. I can tell you my own story. When I was in medical school in Bangalore, one of my classmates was not well. I knew she's not well, but everybody was just staying away from her. And I was very concerned. And clearly she was actually having a psychotic illness. She was a very intelligent student. And just suddenly I saw her getting odd behavior, staring into space. And I knew at that time that she's not well, but I was shocked that some of my classmates were not helping. And I went and spoke to her, tried to help her, took her to the psychiatrist who was there, and he agreed with me. But we had a real battle to get the family to agree for her to have treatment, because a very high functioning family, everybody are actually doctors, and they didn't want the stigma, the label, everything. So eventually she got treated, and it was really lovely when, 15-20 years later, I got a message on Facebook. She's still doing well, she's brilliant, she's working in India, she's got a couple of children. But had she not had someone like me or my psychiatrist, what would we have done? She would have lost her whole career. Anything could have gone wrong. Offering support to a stranger can save their life. A lot of people think, what do I know? I'm not an expert. But actually, if you see somebody who's not okay, just go and ask them, what can I do? Are you okay? Can I help? You might be saving a life that you don't even know about. Okay, and we all save lives every day. You don't have to be an expert. When we listen to people, especially I say this to doctors, who are very busy sitting behind their screen, typing things, and I don't blame them. They are very busy. GPs have to see people in 7 minutes. It's really challenging for the services as well. But if you're listening to somebody, you have to really listen to understand what exactly they're saying and how to help them. And we all have to challenge the stigma together. There's a lot of stigma that we have to work together. And I can give you examples where communities have literally changed the world. So in Trieste in Italy, for the last 50 years, they have a different model of care where there's a building in the community. In fact, one of them is right next to a 5-star hotel. And it's got a 24-hour mental health service with doctors, nurses. 20-30% are people from the community, people with lived experience. Now, we are lucky that in England, there's 6 pilot sites that are being funded for this over the next 2 years. And we're going to do this in our place in Birmingham and Solihull over the next 2 years. And we're very excited to see. And in order to set this up, we've been going out to the East Birmingham communities, finding out. And we've been shocked how much good work happens in the communities that we didn't know. So now we're trying to pull them in and set up this 24-hour mental health service. And we've got really good experts to help us. It's totally changing the way we think. We're going to think of people as equals, as citizens who have, all their needs. It's not just about mental health needs. They may have housing needs, social care needs, family needs. So we have to look after all of them. And I really hope that's the future of mental health care. So we'll see how these pilots go. But there is nothing stopping us as a community in Leicester to do similar, to do something, to make that change. Even if you start in 1 street or 2 streets, you'll be surprised at the revolution. I can give you so many examples from India where people have gone and through palliative care services reached 3,000, 4,000, reached millions of people through 3,000 volunteers. So there's lots of examples that we have to learn from other countries, rather than Western trained people going and saying to other third world countries what to do. Actually, it's reverse now. We have to learn from them. So this concept of normal is very strange to me. We're all unique and special, and we should share more about how we think and feel and hear from others. And no 2 people are the same, which is one of the beauty of being normal. And I like Maya Angelou. She says, if you're always trying to be normal, you'll never know how amazing you can be. So I would say, don't be normal, be special, be you. and don't say that if you have a mental health problem, you're not normal. And I love this quote by Matt Haig. Mental health problems don't define who you are. They are something you experience. It's like you're walking in the rain, you feel the rain, but you're not actually the rain. And I tell everybody that if any of us have mental health problems, that's just a part of us. There's so many other parts of our life. We have to be defined by everything else, not by a diagnosis or illness, no matter what it is. Do we also think about our own health? I can tell you from my own mother's situation, she never thinks about herself. She'll always put others' wishes before ours, ignore what we want to do. And especially South Asian communities, a lot of other cultures, think about ourselves before everybody else, after everybody else. And sacrifice is seen as a blessing. I was brought up like, don't ask for anything, be humble, be nice. And that's very good, but sometimes it goes to an extreme that you neglect yourself. And you always postpone things. Oh, I'll do that when everything else happens. And then before you know it doesn't happen. So a lot of times you say, no, you stop and do it now because tomorrow may never happen. So what happens if we do look after ourselves? And there'll be more talks about self-care. We reduce stress and anxiety, and stress can cause increased blood pressure, diabetes, heart disease, mental health problems. It's really important to not be stressed. And stress is a normal part of life. There's things that will happen that will make us stressful, but it's how we manage it and how we look after ourselves. We're better in when we give to others, or when we take time for ourselves, we actually are better to our families, to our patients, to the people we look after. And actually we do a better job. And this is what usually when I tell doctors, they say, okay, I'll look after myself. Because usually a lot of healthcare professionals hate to take time to look after themselves. It boosts our own self-esteem, increases happiness, improves energy. And it does not need a lot of time. You don't have to put 3 hours a day for self-care. You've just got to put a few minutes every now and then. So I'm going to give you all an exercise, and it may be a bit challenging. So what I thought of initially doing, but maybe you can do it later. I've got these post-its. I'd like all of you to write 3 things that make you feel good, happy. And what we're going to do is we're going to collect them and put them on this flip chart so people can read it a bit later. So no one can escape, everyone has to write something. One thing that comes very strongly is family. I can see family in a lot of these, okay? Exercise, friends, dancing, helping others, listening to music, painting, seeing my grandchildren, going to the gym, watching TV serials, my son, meeting people, cooking, nature, painting. No one's written taking medicine. Okay? No one's written seeing my doctor. Why? Because actually this is what makes you all happy. So it's just for us to think that actually being happy is very simple. So I would like you all to come and read this, and we can write it down and share it as well. So these are just a few examples of self-care and well-being, and I'm not surprised at all that a lot of the things on the list I have put is also on your list. So I just want to talk a little bit about women and mental health, and I will also speak about men, especially South Asian men and mental health. So women find it really hard to talk about themselves because usually they're the caregiver, they look after everybody, they hold the family together. And what's happened is that years and centuries of women being treated as second, third class citizens, we don't even realize that we don't look after women as a woman. So for example, if I give a talk now and you all ask questions, and people put their hand up, unconsciously I will ignore the woman and I will go to the man. And I didn't know this until I started reading up about women myself. So I think we have to make a very conscious effort to support and help women. Because if you can help women, you can change the world, literally. And when we model self-care, when we look after ourselves, people around us feel they have permission. So, there are hundreds of doctors in my organization. If I expect them to work late every day, send emails at midnight, that's not good for their health or for the health of my patients. So I tell them, you need to take time off, you need to go on holiday. I go on holiday because I need it. So we have to model good self-care. And helping others help us too. I've done all kinds of volunteering roles since I was young. It's given me the best satisfaction that I could not get in any paid job. Okay, so sometimes when you give people, you get a lot more back. And in some ways I feel volunteering is selfish. I do it for me to feel happy. You just have to be one person who can change the whole community. You don't need 10, 15 people. And always have hope, no matter how bad things are. Most of the hope I've got is from my patients. When things are really dark, really difficult, when you think that it's really tough time, they're the ones who've given me hope. So have hope and give hope. So this is a really lovely quote, that faith is the bird that feels the light when the dawn is still dark. So the birds know that the light is coming even before it comes, and we should have the faith. Okay, I'll come back. All of you are here. So I wanted to end with that exercise, and the reason to ask you to touch your finger is because anytime you're feeling really sad or it's really difficult, remember that you have this wonderful memory. And just touch that finger that you touch now, and just remind yourself that there were times you were so happy, and there were times that things were so good, and it's okay, you can get better again. So I wanted to leave you all with that, and thank you so much for your time.
I've got a few nuggets from what you've told us in this presentation, which I'm just going to reel off. Culturally appropriate advocacy services needed. Take responsibility of our own mental health. Look after ourselves. Love that. Love the Italian model of the 24/7 building. Whenever you have a mental health issue, you can walk into it. Maybe something that we need to replicate here in the UK. Lots of good work by the grassroots VCSE community, and I'll take that, on behalf of all the stands that are here today. I mean, I am blown away when I see how much work is done by the grassroots in Leicester. It's phenomenal, absolutely phenomenal. What is normal? If you want to be normal, you will not know the amazing person you can be. So let's veer away from what we think should be normal, more towards what we want to be. That's the message, I guess, yeah. Women need to support women. Hey, I really back that one. I'm sure all the women here back that one, definitely. Definitely. And being happy is easy. Think of that glowing moment and touching the finger. That was an amazing exercise. So thank you very much. A big round of applause, please, for Dr. Babita Arya. Oops. Let's go back. Here we are. So it's my pleasure now to introduce our next speaker. Not new to the People Centre, I hasten to add. So those of you that have been around to some of these presentations will know this wonderful gentleman, Dr. Neeraj Singh. Dr. Singh is a consultant psychiatry and specialises in neurodevelopmental psychiatry. He has extensive experience in treating adults with ADHD, mental illness associated with autism and other mental illnesses. He is a fellow and executive committee member of the Royal College of Psychiatrists with both regional and national roles, and has an MBA and postgraduate diploma in mental health law. Since 2009, Dr. Neeraj Singh has worked as a community NHS consultant and also in private practice, and has been involved in the setup of healthcare sector services as well as personal coaching and mentoring. In 2021, he took up post as an executive committee member of the Medical Cannabis Clinicians Society. So with that, I give you Dr. Neeraj Singh.
Thank you so much, Santosh, and it's always wonderful to come here. I think I've been coming here for about 2 years now, and time flies when you're having fun. It's been absolutely wonderful to meet a bunch of like-minded people who are interested in the welfare of others, because that's what we're here about, aren't we? Yeah, we're here about other people, but we should be here about ourselves as well. Yeah, because if we don't fill our own cup, how are we going to help fill the cup of others? Yeah. So that's what I'm here to talk to you about. And we all know, many of you might know what the theme for the World Mental Health Day is. It's about workplace and mental health, yeah? Work doesn't have to be about paid employment. A lot of people here do voluntary work, yeah? Putting out a substantial number of hours to serve others as well. But it could be household work as well. Yeah, it shouldn't just be automatically about paid employment. And work can be really beneficial to us. Yeah, for our own mental health. So I want to talk to you a bit about that, about how does work help? It's a source of income. It gives us identity, it gives us fulfillment, it gives us contact and friendship with others, the interactions that we have day to day. And many of us can spend a substantial amount of time at work. And unfortunately, our identity can get wrapped up in that. But we're not just about work. Yeah, a lot of people may go through qualifications or actually, strive really hard and build up so much to get to a certain place or get a certain promotion. And then they suddenly feel, actually, my whole identity is wrapped up with work. But it shouldn't just be about that. Work is part of that, but it's just one part of your identity. It allows for routine and structure and opportunities to contribute and gain skills. So as we work, we learn more about ourselves, we learn more about others, and we develop ourselves in the right environment. But actually, as time goes on, it potentially can be quite wearing. Now we're living in more stressful times. Yeah, the reality is this. So what do we need to do? We need to have more inner checks. We have to check in with ourselves. It's all about, and you've heard me say this before, we have to be more kind with ourselves. We need to have more compassion for ourselves, because if we don't do that, we can therefore not give that kindness effectively to other people. Are you feeling more tense than usual? Are you not sleeping as much or eating as much? Even if you're not the person experiencing that mental health, can you be somebody who checks in with the other person? Yeah? Just the simple thing of checking in, how are you? Yeah, with the other person. Yeah, it has great power, believe me. Yeah, just asking that question. A person may be shielded, but at the end of the day, you can ask that question, and that will lead to potentially that person's guard coming down. And that's it, because more and more these days, people are becoming more isolated and actually feeling lonely as well. Yeah. And that's reality. And loneliness is a feeling inside. You could be surrounded by so many people, yet feel the most loneliest person in the world. Yeah? And that is why we need to be understanding and ask these questions to our co-workers, but not just our co-workers, anybody around us, friends, family, anybody else. That's a simple act of kindness that we should all be involved in. It's that person's demeanor change, the personality, there's something different about that individual. That's not that acting in the same way. They might be more anxious as well, and just generally more withdrawn from general social interaction. Personal care might be affected, so they might not be showering as much. They might be involved in more alcohol or substance misuse as well. And generally they might be exhibiting feelings of hopelessness. So these are certain signs that we need to look out for declining mental health. But there are often barriers to seeking help, yeah? Businesses or organisations, everything is stretched these days, small and medium enterprises. And lack of resources can often be one of the big issues. Time and money being the main thing as well. And it's how much of it is an importance to that particular organisation where that individual is working in. Because if we have the fundamental policies and procedures in place, that's all well and good, but it shouldn't just be about what's called tokenism. It shouldn't just be about a certain document that has this. It's how is it being implemented? Because fundamentally, if somebody has optimal good mental health, they're able to function much better. It's very obvious actually day to day that they'll be able to do that and be better at their work as well. But though time has evolved, and actually people are gaining more knowledge about mental health and it's much more out there, there is still insufficient knowledge about it, about how these interventions should be embedded within companies as well. And lack of clarity about what interventions and what certain circumstances for these individuals would be beneficial to, and how effective they can be. And often it's not seen as a priority. Yeah, somebody can ring up and say to their boss or the manager and say, I'm not feeling too great, I broke my arm yesterday while I was doing XYZ or things like that, and then automatically they would do it. But it's very difficult for somebody to ring up and say, look, I'm feeling really sad, I'm feeling really depressed, I'm feeling really anxious. Yeah? And though we're having much more of a move towards people explore, can they have mental health days off, there is still a taboo and still a stigma around it. And that's the reason why a lot of people don't seek the help, because they're fearful of stigma and discrimination as well. And work pressures day to day will not allow them to participate in those particular interventions, because there's a lot of disinvestment happening in businesses as well. People are getting more and more stretched. People have been asked more of what to do, and obviously that adds more and more to the stresses. So ironically, when they need the help the most, actually they themselves do not have the bandwidth to explore that. And lack of structure and actual people to implement these interventions can be a barrier as well. And management commitment and general disinterest really in this whole area. Like I said, mental health, emotional health is a fundamental pillar of health as a whole. You would have heard from me say before, the mind and body are not separate. We think of them as separate because we've got separate health specialties, be it psychiatry, or physical health, or you get a doctor for your heart, your lungs, your liver, you name it. There is a doctor for every organ of your body. However, it's one ecosystem, and that's the way we need to think about it, and we need to be thinking about emotional health and mental health being that fundamental pillar. So, some of you will have heard me talk about this before. Yeah, I'm not going to make any apologies for repeating this, guys. It's good revision. Yeah? And health should be about us taking accountability for our own health. We are in a system where you get an assessment, you get a diagnosis, and then you get a treatment plan. Yeah? And it's a very good system. However, it's a reactive system. Yeah? It's when somebody gets ill that they seek help. Yeah? So what's more important is what actually happens then is we outsource our health to others. We outsource our health to the system, whereby actually what we should be doing is taking more personal accountability from a young age. And this needs to be taught in schools. Yeah? So in schools, my boys play football, cricket, you name it. Lots of emphasis on physical education. And then when they hit secondary school, then it gets busier, more and more homework. And before you know it, physical exercise and all those things start to go off the wayside completely, and people don't engage in it as much. But this is the thing, it should be, as one gets older, these need to be the fundamental things that happen in day-to-day life. Yeah? And why is it important? Yeah, because prevention is ultimately better than cure. Yeah? But how much of the NHS budget is spent on promoting prevention? Does anybody remember? Little, absolutely. Does anyone want to throw a percentage? 10%. 5% is spent on that, yeah? Which means what's the rest of it? The rest is spent on reactivity. Yeah, exactly, yeah? So what does that mean to us? That means we need to take more personal accountability for our health ultimately. That's what's really crucial. Why? Because as one gets older, our risk of developing illness also increases. Our risk of developing cardiovascular disease increases. Our risk of developing cancer increases. South Asian population have higher rates of diabetes, and we also increase the risk of what we call neurodegenerative diseases like dementia, like Alzheimer's. Yeah? And all these illnesses I've just mentioned, how common? We think of them as separate, but they're all fundamentally linked, and they all cross over each other as well. Yeah, which comes back to the whole idea: mind and body are all connected. Yeah, they're not separate as well. And we always think that if we have the genes, then we're automatically going to get the condition. Yeah, but again, I'm going to ask you again, for the people who were here before, how much do you think in terms of illness is genetics responsible versus the environment? So when we have the genes, environment might be responsible for switching on or off those genes, which might then cause those illnesses I mentioned. But how much is down to genetics, do you think? Is it the majority? Is it less? Is it more? It's less, yeah? But you would think actually, and a lot of people traditionally would think actually, it's got to be 80%. No, actually it's 20% is genetics, the rest is environment. So what does that mean? It means that what we do in our day-to-day life has a fundamental effect on how our health evolves throughout our life as well, and how we can prevent those illnesses happening. So how can we do that? So here is an acronym, SHIELD, which I found from somebody on Twitter. Actually, they didn't give their name, but I found it a really, really wonderful acronym just to remember. And these are areas which we all need to be focusing on a day-to-day basis to optimize our health. And I'll be honest with you, as a doctor, being medically trained, a lot of this I was not trained on. Yeah? And actually hasten to add, probably some of you will know more than myself on the subject. I've actually learned this along the way. But I'm going to ask you a question. If in terms of health, what do you think S stands for? What do we need to focus on? Self? Well, yeah, that's part of the whole thing. Yeah. Sleep, exactly that. Yeah, that's just a picture of it. But sleep. Who here would say that they get between 7 to 9 hours of sleep a night? I'd say that's less than 5% of the room. Wow, yeah. I did put my hand up, did I? No, that's included, 6%. So, we're a sleep-deprived society. It's a pandemic, it's an epidemic, globally, for multiple reasons. Stresses have gone up. It's often not seen as a priority to get good sleep. Let's just get on with the day, let's get the tasks complete. And I think the average is 5.5 or 6 hours, I think, a night, which is not enough for a lot of people. Now, there are certain people where we all have different what we call sleep cycles, yeah? And some people can survive on much less hours of sleep. But actually, the reality is many of us need that between 7 to 9 hours to optimally function. Yeah? Why? Because otherwise, you increase the risk of mental and physical health problems. So how can you do that? By having a regular routine. Also, what we need to do is, these days, we spend more and more time indoors. Yeah? But we need to get outside for at least 20-25 minutes a day. Why? That we expose ourselves to the daylight. Yeah? Then those messages come to our brain that this is the day and this is the night cycle. Yeah? And then our brain can produce the necessary hormones or signals to help us get to sleep at night time. Yeah? So 20-25 minutes a day, getting yourself outside is absolutely vital. Yeah? Couple it with a walk. Go out into woodlands or somewhere else. But even if you were just not to even have a walk and just get outside into a garden or another area just outside the building if you're at work, that's really, really important as well. Yeah. What about these things? Yeah. Collective sigh. Yeah. Blessing and a curse. It is, isn't it? Really. The reality is that these are here to stay. These things, and we'll probably have them embedded in our bodies or something eventually, or with contact lenses or something like that is going to come, isn't it? Thank you, Mr. Musk. So, when I say a blessing and a curse, yeah, technology has been very advantageous to us. Yeah, it helps us communicate across borders very quickly with loved ones and work efficiencies. But actually, at the same time, we have to understand that they also can be drawbacks to using these, yeah? Not least because they produce a lot of blue light, yeah? And that blue light is telling us, our brain, that it's daytime. So how many people actually are lying in bed on their phones? I have done it. Yeah, a lot of people do, don't they? Yeah. And that is completely the thing not to do, yeah? For multiple reasons. The other thing is, these things produce electromagnetic radiation as well. Yeah. So the reality is, you should switch these off and put them away, and ideally in another room, to be honest. So it's important to really get these switched off. It doesn't matter whether it's a phone, a smartphone, an iPad, a laptop, whatever it is, even the television. Yeah. Because I love Netflix and whatever, and there's some people watch TV serials, ZTV is it, and all that, is it? Yeah. I know those go late because my mother watches them as well, and they go on till quite a long time, don't they? But 2 hours before bed is what's really important to get them switched off. How often? So, how often do you think people change their bed mattress? Yeah, 10 years, 8 years, 22 years, every 22 years. Yes, people keep them for such a long time. Should be changing them at least every 6 years, is a reality, yeah? But it's one of those things, yeah? A mattress is so important. And it just goes to show, actually, people really underestimate how important sleep is in their life, and we should be when we spend a long time, actually, of a part of our life doing that, it should be optimal. Why aren't we investing in good mattresses, good sheets, cotton sheets, blackout blinds in the room? Yeah. Other things are like avoiding caffeine after midday, avoiding excessive sugar, maintaining hydration, reducing alcohol as well, and this thing called circadian lighting. So again, and this is how you see these in hospitals as well, artificial lighting. Again, a blessing, but at the same time has the drawbacks. Yeah, even the street lamps as well, when the artificial lighting is basically telling you that it's daytime. Yeah. So what you need to do in your house is really start to dim the lights as you get towards the evening, and so help reduce and help encourage the brain to produce those chemicals which can help you get to sleep better. H stands for handling stress. Yeah, like I said, emotional well-being has to be the fundamental pillar. Yeah, you have to have those inner checks. You have to have the review and lifestyles and commitments. You need to take on as much. We did some wonderful breathing exercises just now. Yeah, I'd hasten to add that a lot of people felt really good after that exercise that Fabida showed us. Yoga and meditation, mindfulness exercises, yeah. And seeking help. Yeah, seeking help when you need to is really, really crucial. And not to be an island. This is one of the beauties of this place, is that people come together, and because interaction is so important to us, yeah? And socializing is medicine for your brain and body. And the paradox is that if people become ill, mentally or physically, they're less able to interact with others. But this is where an area like this, like the People Centre, comes in, because it's supporting people who do have difficulties. And we need to celebrate that. The community is actually really vital for one's health. Meeting up on a regular basis and sharing learnings, as we're doing today. This is all contributing well to our health, and engaging in music and the arts, another thing that this wonderful body does as well. And Z's no doubt going to get us into this in a few moments as well. I always write this down 3 times, yeah, because exercise is so crucial. Yeah. How many people here exercise on a regular basis? More than last time. Maybe I did say. That's wonderful. That's wonderful. That's really good. Yeah. Exercise is the single most important thing you can do to promote your health span and longevity. Yeah. Yeah, we talk about lifespan when we talk about health. Yeah, that's how long you live. But we should also, the conversation should really about health span. Health span refers to the amount of time, yeah, the duration which somebody remains illness-free. Yeah. So as we get older, we don't want to become ill. We don't want to have lots of medications. The reality is now we're in a system where, as one gets older, people get more and more medications. It's not uncommon for people to have a dozen medications for different conditions, high blood pressure, diabetes, and so on and so forth, yeah? Multiple medications, yeah? But you've got to think about it. What kind of quality of life is that individual having? You can increase your quality of life if you make changes, and it doesn't matter what age you do that at, yeah? If you're a young kid, you can be in your 70s, 80s, 90s, it doesn't matter. As long as you start, that's the most important thing. And like I said, the single most important thing you can do is exercise, yeah? And particularly resistance exercises, strength training, like your muscles. So people often traditionally think that muscles are just there for pushing and pulling, opening doors, pulling doors, and all that side of things. Absolutely not. Your muscles are really crucial because they're linked to your immune system, they're linked to your gut, they're linked to your brain. When you exercise them, they produce these molecules which actually go to your brain, which help reduce inflammation. And more we're learning that things like depression, anxiety, and other mental health conditions are actually linked to inflammation. Yeah? So what do we need to do? Yeah? Inflammation basically means that effectively the body's like on a kind of fire. Yeah? We need to dampen down those flames. Yeah? And we can do that one way by doing exercise and resistance ones. And often people think actually when they get to a certain age, actually we'll do swimming. And swimming is really good because it increases your lung capacity. That can be really helpful, yeah? And I think that that's something I would encourage, yeah? But it shouldn't just be a substitute. Yeah? You can't replace what's important. It's like strength training and doing weights and resistance exercises, absolutely vital as well, alongside, yeah? Breathing exercises as well, avoiding sitting for excessive amounts of time. Yeah, so a lot of us, I think, have sat for more than 20 minutes. Yeah, so we're going to stand after this, right? And Z's going to make sure of it. Yeah, that's an interesting one. I think I recommend giving yourself at least 2 hours before. Yeah, 2 or 3 hours, I would say. Yeah. Yeah. Yeah, that competes with the melatonin, that's right, yeah. Walking, yeah. That's right, yeah. So a light walk after eating, for example, what they've said is actually, there's a lot of research now that's going into, after having a meal, going out for a walk will help regulate your sugar levels better, yeah? So doing something like walking, intense exercise, absolutely not before going to bed, yeah? For the reasons that Z mentioned, yeah? It produces more of the stress hormones, which will then stop you from sleeping. And I'm sure many of you would have, many of us have already experienced that when we've had sort of intense exertion. It's very difficult to get to sleep, isn't it, after that? Yeah. And going out in nature is really important. Yeah, when you go out into the woodlands and forests, it's not just the oxygen and wonderful things that the plants are producing. Actually, they also produce these chemicals called terpenes, which when you inhale are actually anti-inflammatories as well. Yeah, so the forest is medicine too, or the woodlands are medicine too. Nature is medicine. Learning new things, difficult to probably read that things, but taking up new hobbies. Yeah, there's this kind of silly notion. What's it called? That old dog new tricks thing or something like that. Yeah, ridiculous, absolutely ridiculous. Yeah. Learning it can be lifelong. Anybody can pick up anything at any time. I know an uncle of mine who's just picked up the guitar. He's 72, never played it in his life, and now I think these days you can get a lot of videos on YouTube, you can get lots of apps, you can access, and I think that's a wonderful thing. That is so beneficial for your mind, body and spirit, to be able to pick up an instrument and then, you know, really start to get it. You don't need to be an expert, yeah? You just need to start and get involved. And actually, it also helps with the kind of community aspect of things as well, because then people can meet like-minded individuals in the same area too. But doing something meaningful to you, that's what's really important. And diet, yeah, really crucial. Who here says that they've got a really good diet? It's very yeah. It's very individual, isn't it? And this area has resulted in so much, I would say, debate, controversy. You get all sorts of different sorts of diets out there. I think, was it in the mid-90s, they had the Atkins and things like that, where you have to cut down carbohydrates completely or something, or you cut down fats completely, or you kind of do that kind of stuff, yeah? What's really important is that these days we have a lot of processed foods, ultra-processed foods as well. Yeah? And what we really need to do is eat more natural foods, from the source, really important. Mostly plant-based, avoiding excess sugar, having good hydration, plenty of fibre, dark-coloured foods, blueberries and black beans for example, and adequate amounts of protein, which is actually often missing from the South Asian diet, am I right? Yeah, because it's quite carbohydrate based. Yeah, so it's important for you to reflect on how much is your protein intake, what the protein sources are as well. Is really crucial. Alcohol as well, yeah, it's within our society, but actually it's a neurotoxin. What it means is actually it's not good for your brain, it's not good for your body. It actually increases inflammation in your body, and it actually affects your gut bacteria. Yeah, so in our gut are lots and lots of good bacteria which helps our body's processes, yeah? Trillions and trillions of bacteria in there that help our mind and body. Yeah? But alcohol actually kills off good bacteria, yeah? So it can affect the body in many ways. Yeah? And take foods to help boost that, what's called the gut microbiome, all those bacteria, probiotics as well, because the gut and brain are connected. Who here feels good when they've eaten, a nice healthy meal? Yeah, we all do, don't we? Yeah, and conversely, we can feel really sluggish and heavy and things like that when we don't we? When we have a very oil-laden meal, for example, when we might be out in a restaurant. So our mood, our mind and body can be affected by what we eat. And sometimes what we call calorie restriction and intermittent fasting, yeah, but you need to consult your doctor about that. Fasting has many thousands of years of history behind it and actually health benefits. But it's crucial that with all of these things, actually, you do consult your doctor and avoid fad diets. Do some research and do speak to a health professional or an expert in this area. Thank you very much.
Sorry, obviously my background's education, and it links a little bit to what Dr. Arya and Dr. Singh said. I had it already ready. The statistics of children is 1 in every 5 child suffers with mental health. Now in schools we push it so much, and at the minute we have a massive gap where now you're trying to push it with the adults who've been told all their lives, no, get on with it. And now you're trying to push them to help, and then at schools we're pushing it to it's okay not to be okay, but it's 1 in 5. So the statistics are that in 2023 20.3 children who are aged between 8 and 6 have a mental health disorder, and 23.3% between 17 and 19, and by 14 50% of the mental health issues have been established. And they're saying that early interventions, which we do heavily in primary schools, are helping stop it going on further. And just to really, this is not a nice one, but 2013 suicide rates in children due to mental health was up by a quarter, and nearly half of 17 to 19-year-olds have done some form of self-harm or attempted to do suicide. So it's a massive push in schools relating to what Dr. Arya and Dr. Singh said. And helping us now as adults mean you're also helping other generations. So it's a big, really important thing. On that note, you've got 10 minutes, 1 o'clock, so 10 past 1, please be back. Go have a stretch, go get a glass of water, a cup of tea or something, chit chat, and we'll see you back in 10 minutes.
So I'm really excited that I can welcome Rachna Vyas today to our special mental health community event. For those of you who don't know Rachna, maybe there are a few people who haven't met you. She has a very big title, I have to say, for you Leicesterite. She's the Chief Operating Officer and the Deputy Chief Executive at NHS Leicestershire and the Rutland Integrated Care Board. And she's kindly agreed to come today out of her very busy schedule, and I know you've got loads on, just to come and say a few words. So I'm going to hand straight over to you, Rachna.
Listen, you don't understand how important this event is every year for our community. We come together, we talk about something that, if you think about 10 years ago, our communities didn't want to talk about. We didn't want to talk about mental health, we didn't want to talk about adult mental health, children's mental health. We certainly didn't make the links between diet, as Neeraj just did with us, and mental health. So it brings me so much pleasure that we are openly talking about this stuff, which makes such a difference to our communities, whether you are a child in this community, whether you are one of our adults, whether you are male, whether you are female. It is so important. And not only that, but for our next generation that's coming, particularly, so I've just said it, my children, for example, and the children who live in this community. I think it was my colleague here who talked about the impact that, particularly since COVID, we have seen on young people. The amount of people that we've got coming forward now for our services, whether they are online services, whether they are these fantastic mental health well-being cafes we have in our community, people are accessing services, which is brilliant. So the one thing I would ask you to do today, you are all here, and it's wonderful to see so many of you here. If you go away and tell one person in your community who doesn't want to talk about mental health about this stuff, you've got Live Well Leicester here, who are brilliant colleagues, you've got Health Watch here, you've got Shama here, you've got Jamila's Legacy here, all of these support services which we have designed with you, and you have really helped us to design in the way that you want to deliver them. And so that's why we have these things in the centre of the community. So if you think about and I'm going to give a plug here for our mental health and wellbeing cafes, we worked so hard to take these cafes out of your big stuffy NHS buildings, and I know a lot of them are big and stuffy NHS buildings, into where you wanted to come. You said you didn't want to go to those buildings, we brought it out into the community. So the more information you give us, the more help you give us in designing these services how you want them, how your family wants them, how your community wants them, we will respond. There are people like me, there are people who are here in the audience. We will listen. We can't promise everything to you, but we will work with you to do the best that we can. But yes, one thing, I'm giving you homework today. Please go home, please talk to one person who doesn't want to talk about mental health, and please make sure they access all these wonderful services that we've got here, because as I said, they're for you, they're designed by you, and if they're not right, which I recognise we've got a lot of work to do to make all of these services right, come and tell us how they're not right, and we will do our utmost to make them right for you and your families. So thank you, enjoy the rest of the day, and that's all I want to say.
Thank you, Ratna. So just to sort of summarise those last 2 points, go and talk to one person about their mental health, their emotional, their well-being. That'll be a job done from here today. And I think the second piece is really important, the feedback that we as a community, what would we like to see the NHS deliver? And so if you've got any thoughts about that, I'm happy to take a list today, or we can actually give you details where you can email us, or we run the People Mental Health Cafe every Wednesday 2 to 7 p.m. Stop by and tell us A, what you thought about the event, and B, what else would you like us to have within the event, and also for yourselves as a community, for your mental health. What would you like? Where are the gaps? Where are the misses? Where are you not actually being able to get heard? And I know GP surgeries has come up, so and that's been one of those things. There's obviously a crunch, a people crunch there. So yes, do come and talk to us. So thank you very much again, Rachna, for taking time out today. Thank you. I'd like to invite our next guest, probably not a new face to many of you, Councillor Manjula Sood MB. She's the Assistant City Mayor for City East with responsibilities on community cohesion, the armed forces, and is also a High Bailiff. So Manjula ji, please come and say a few words as well today.
First of all, I would like to say Namaste, Sat Sri Akal, Assalamu Alaikum, and good afternoon to everyone. And today, those who are celebrating the Shara, I wish them very happy, prosperous time and next year. And I was thinking it is very timely today, because the Shara we celebrate the victory of good over evil, and mental health in our society is evil. As in many communities, you can, and with my responsibility of community cohesion, I know how many people are suffering out there. They talk to me, but they wouldn't access to the services which is provided because of the cultural needs. And City Mayor has asked me to pass on his best wishes and all my colleagues that they would have liked to hear, but being Saturday they got other events. And thanks to People Center, last year they had this event. Since Santosh, you have taken over, you have put mental health on that data at the radar on the front, which is very good. And I was looking, this is overcrowding. Next year we need a bigger space. You can see how people are coming here, and this event wouldn't have been possible without the wonderful speakers. Neeraj, he calls me auntie, so I call him my daughter. And Fabida ji, yours was, and other people who are sitting, and I'm sure there are a lot of them who would like to come and speak here, but it's the time doesn't permit. And all this information outside the stalls is amazing. And I would like to say thank you to volunteers, who do a phenomenal contribution to the society. One thing which you have mentioned about doctors, but still many doctors are not trained, they are not aware of mental health. Even if you go to A&E, they ask you what we are supposed to do. So that question really puts misery in people's minds. So this is why we have to really have a big training for the doctors. And congratulations to you for taking up this role. And I'm sure you are already doing a great job. And there are too many labels and stigmas. The person, in many languages, there is no word for depression. या तो आप पागल हो या आपको कुछ नहीं होगा. Either you're mad or nothing is wrong with you. And these labels are really bad. And in some places of Russia, it is seen person is possessed. For God's sake, they are not possessed. They need help. They are vulnerable. They are broken. And I now have got the role for an armed forces champion. And you won't believe our soldiers, the veterans who come back, what mental health they are going through. Nobody is ready to listen to them because they have been right on the front line with the wars. Their families are suffering. This is what we have. It is a collaborative work. We all have to work, and mental health is everybody's responsibility. As I said, in my personal life, I have gone through that. After the sudden death of my husband, bereavement, doctor referred me to the general hospital, and the nurse, she asked her to do creative writing, and she looked at it, she said, "There's nothing positive in it." I said, "That's why I'm here, because my life is negative." So I discharged myself, and that made me determined that I'm going to do something on mental health issues, so that other women, like you said, the women, they suffer more, because there are so many things which I can't do, which lead to mental health. So we have to really work very together. And one my request is, please do not judge. If somebody comes to talk to you in confidence, signposting to the help. Look outside, all these organizations, they are there to listen to you. And one thing is, how do we change the mindset of people? There are people on mental health who are on the road to recovery, but society doesn't accept them. They still judge them that they got mental health. No, I know so many of them. That's why that among young people, suicide rate is increasing, because society is still undermining their ability. They are fine. Doctors have discharged them, but society doesn't accept it. And it is alarming. I'm working with some families whose children have committed suicide at young age, like you said, on education. So if we do not change the mindset, this will continue. Do not, those people who are on the road of recovery, just help them. Let them be a normal person. Okay, they have done some mistakes, because they were not aware of themselves. But listen to them and work. And schools, they need to do a lot on that. And one of the mom whose son committed suicide, she has started the project on bringing awareness on mental health and how we can help children. Her name is Meena Rayat. She is really working very hard on that. So this is what I would like to say, to thank you to People Center, honestly. To bring everybody together on Saturday, it shows that there is a need, and we need to come together and work together on this. And each one of you who are involved in mental health projects, or even looking after your neighbor, to me that is a big service, helping you somebody who's got dementia or mental health. And the carers, they suffer as well. And I've been a carer as well, so this is what I said. Please keep it up. And this mental health cafe is very good. Maya always gives me the report on that. And Racha, we need that, like this more in the day. And in some areas, especially for women, steady steps, Ranjanji, you were talking, I think they need to be there, that the women can go and, some of them they don't want to go to gym, they don't want to go anywhere. But if it is in the local community, they can attend that, and it will help their mental health. And this is why on this one, you are the people who have to really train doctors, tell them. And the one thing I will disagree with on diet. I know it's very good to have that diet, but look at the cost of living. How people can afford that? They can't even pay bills at the moment. They're struggling. So whatever comes it, they eat. Some people are making choices whether to have a diet or look after their children. So that is where it is for people who are affluent, who can afford it. But that diet is not for people who can't afford. Because as a counselor, we know there are so many people who are struggling. Diet comes at the bottom of the list after paying bills. Look, private rented accommodation, £1,000 they are paying, and they are not even earning that much money. So that one, if you can just slightly say at the bottom that people, they should be given some help for the diet, please. I know food banks are there, but everybody doesn't want to go to food bank. They feel ashamed. So this is why that the rest of is perfect for that I was thinking. And thank you very much, Santoshi. And we hopefully will work together again. And I'll take it back to the city mayor and explain to him.
Yeah.
And thank you. And thank you.
Thank you for those important words, Councillor Manjulaji. Thank you. I'm going to now move on, up the pace a bit, and we have our next presenter, Z. And let me just give you an introduction on Z. Z's been a passionate lifestyle well-being enthusiast in the community for over a decade. She's a certified personal trainer and founder of Z-Fit, specialising in female fitness. Z-Fit's vision is to empower communities to thrive, to enjoy their best health by making knowledge and wellness accessible to all. Through personalised coaching, motivational support and group sessions, Z strives to inspire others to embrace an active lifestyle and optimise health. The Z-Fit philosophy is harden your body, soften your heart and sharpen your mind. So Z, kick it off.
Right, hello everybody. Hello. I'd just like to say, first of all, again, following up on the guest, thank you Santosh for putting on this wonderful evening. Mental health is something that's very close to my heart, and I'll explain to you why in a second. So Santosh, thank you so much. And thank you for putting me on a platform in front of these amazing people. I always feel very humbled. Sorry, am I speaking? Humbled and privileged. I don't have a title in front of my name. I'm a girl born and bred in Leicester, grew up in Leicester, so I'm very much a grassroots local girl. So you know, I feel a little bit humbled, a bit nervous following on from these wonderful people. So apparently I was named after a Bollywood actress. So I'm going to go in true Bollywood tradition. And if anyone's watched a Bollywood movie, most of you in this room will have, it always starts off with a bit of a song and a dance, right? Yeah. So that's what we're going to do. I've not got Bollywood for you today. I'm going to mix it up for you a little bit. So you can do this sitting down, standing up, it's accessible to everyone. I always say, do what you can from where you are. So even if you're just sitting down, everyone can make some noise, is that right? Yeah. Alright, so we're going to do it. So we're going to do a bit of a song and dance, a bit like a Bollywood movie, and then we're going to move on. Alright, okay.
Sensual, un movimiento sensual. Sensual, un movimiento sexy. Un movimiento sexy. Un movimiento sexy, un movimiento sexy. sensual, como de sensual, como de sexy, como de sexy. Y que se baile que es una.
Just before I begin, I just want everyone to take about 10-15 seconds. How do you feel? See a lot of smiles. Felt good? Okay, so that's, I've just given you my prescription for my mental health. That's my prescription. Okay, my presentation's a little bit different. I apologise for anyone who doesn't like the colour red. Red's my colour. So, right, so what do we say here? Movement is like a midday snack. It keeps you going and makes everything better. That's my personal philosophy. So here's some stats for you. I know we've had a lot of stats, but over 970 million people worldwide are dealing with mental health conditions. Anxiety, depression are at all-time high. I believe for every problem, the solution is simple. It's the distance between the two where the mystery lies. We are in the middle of a global health crisis. We all know that. We've heard it, from Dr. Ari as well. We've gone through all of the statistics. 700,000 people take their lives. Suicide is now the second leading cause of death among teens and people in their 20s. I really had to, when I was putting this presentation together and reading the stats, it really dawned on me where we're at and how we got here, and what a vital role so many of you in this room play. I know so many people, as I've gone around and I've seen some familiar faces, you work tirelessly in the community, and yet it feels like we're just touching the surface. So, I'm not going to keep on going to the stats, we've had lots of stats. I'm going to go on to the main point of today. I'll get the right slide up. Right, so, thing is the new smoking. Anyone heard that phrase? Unfortunately, it is. The brain is not an isolated, it's not isolated from the body. The body and mind, as we know, is connected. I'm just going to go on to the part, let's get past this, that's right. So the body and mind are connected. There's certain things called neurotransmitters. We've heard about those. I'm not going to bore you with science. I'm not a scientist, I'm not an expert. But before I actually go on to this presentation, I was going to save this story to the end, but I'm going to actually tell you the story at the beginning. There was a lady, a young girl, aged 19. She came to Leicester from Kenya, 1969. In 1973, she met a young man, a very handsome young man. Both of them were at the peak of their careers. The lady was trained to be a nurse, and the gentleman had just finished his engineering degree, or diploma as it was called at that time, from Leicester College. He was a manager in a factory. They met, they fell madly in love. They were from different religions. They got married. Society didn't like that. The lady went on to have a baby very soon into the marriage. She didn't feel very good in her body, so she went along to the doctor. Said to the doctor, I don't feel very well, I feel a bit depressed. The doctor gave her Valium. Off she went. She continued to feel really lonely. Her sisters didn't. She was one of 9 sisters. An elder sister had already committed suicide. And she began to feel feelings of hallucinations, depression, suicidal thoughts, so she went along to the doctor yet again. He continued to give her Valium, up the dose. He didn't ask her about anything to do with how she was at home, the fact that she just had a baby, she had no support. She was married into a family where the family didn't really understand her because she was from a different cultural background. One day things got so desperate that she felt there was nothing for her left in this world. Her daughter was 4 years old. She said to her daughter, just wait here, I'm just going to go to the corner shop. She went to the corner shop, right here in the streets of Leicester. She went to the corner shop and she bought a bottle of gasoline. She came home, she said to her daughter, put your hands out because this world is not for us. The daughter didn't know what was happening, she was only 4 years old, quite scared. The next thing you know, there's ambulances, there's fire engines, and the house is on fire. She just tried to take her own life. She suffered 70-degree burns to her body. The daughter, oblivious to what's going on, as children are, was playing with the little fire engines and the police, the little sirens, as the ambulance crew took care of her mother. Her mother had to go through intensive surgery, reconstructive. She was also institutionalized, medicated. She was given 11, let that sink in, 11 electric shocks. When she came out, she was no longer a person. This lady who was a beautiful, on all accounts, lady who had her whole life ahead of her. She was into singing and dancing. She won all her regional competitions. She came out a cabbage. And the girl, not unknowing to what was ahead of her, became her carer. She did her cooking, cleaning, gave her medication, fed her mum, but she never knew her mum. And that was her life for the next 20, 25, 30 years. That girl is me. Okay, so realistically, the reason I'm stood here and why I do what I do is because of that story. And why I feel the reason I was called here is to give anyone that is in those situations, whether you're the daughter, the mother, the sister, the auntie, you are seen, you are heard, and you are not, as you would say, Bagal. I grew up with fingers being pointed at my mom. I grew up with society, the stigma, the labels, you name it. I haven't just seen it, it's not a story, I've lived it. But I went on, I had a career in finance, I was nominated for awards that were national in finance. I've gone on to have lots of careers, and as I stand here today in front of you, I'm here to give you hope. I hope that's why I do what I do. The presentation is there, we all know, right? 150 minutes of exercise, we've heard it, we know that. I don't need to tell you that. So what I was about to tell you, so there's a story that I was going to tell you at the end. But realistically, the reason I told you this now, maybe this will drop home a little bit further for you, because I refuse, let me just say that again, I refuse to let the doctors give you a label, okay? Women, as women, we are different, we are different. We have things called hormones, which do interact at different stages of our life. Whatever gender you are, whatever your belief systems are, to enjoy good health. But you know what, a lot of it is free. It's just a matter of, it's doing it. It is absolutely doing it. I'm not going to bore you with the science of it. There is a lot of science to it. Okay, so let's talk about anxiety and fatigue. Now, anxiety and fatigue can also present itself as burnout. Anyone know the symptoms of burnout? Yeah? Burnout is something as professional, because I come from the corporate world. Before I came into this world, I was in the corporate world. And we didn't have a kind of an understanding of what burnout is. But for professional women, and I coach a lot of professional women, I am seeing a lot of burnout. And for those of you that are in high stressful jobs, which a lot of us are, it's not just about mental health,
outside. It's about making sure that you look after yourself in the workplace. I always say to women, put your oxygen mask on first, not just women, everybody. Put your oxygen mask on before you, that's what they say to you when you get on a plane. Before you look after anyone else, put your own oxygen mask on first. So having time out for physical activity, we do something that's called a breakfast challenge first thing in the morning. All my ladies do it and they're accountable. So every single morning, if I don't get a tick from you and you're in my group, you're in trouble, all right? Whether everyone makes a cup of tea here, I talked about this last time. Who brushes their teeth in the morning? If we don't, we've got problems. We have big problems if you don't. All right, so what I'm trying to say here is, when you wake up in the morning, we have an upsurge of a chemical called cortisol. Cortisol is our stress hormone. We need it. Why I recommend a physical activity, I don't care what it is, whether you're dancing around with your kids, running around after your cat, your dog, or whatever it is, squatting, skipping. I have a skipping rope in my kitchen. I get the skipping rope out while my kettle boils. That's my 2 minutes. I put my tick on. It's simple. Habit. Anyone that's read the Atomic Habits, that the book. Yeah, it's about attaching an activity to something that you do, and then the reward is your cup of tea or whatever it is. It's really, really simple. It's breaking down a science of building habits. That's all this is habits. So first thing in the morning, just like you would brush your teeth, so just like you've been tasked to go and tell everybody about this activity, I'm giving you a task. Everyone in this room today, when you go home, first thing in the morning, do it by yourself, do it with your kids, get the whole family involved. 2 minutes while that kettle boils. I don't care whether you dance together, hopscotch, I don't care, skip, do what you can, just get that body moving. What that does is all of this. It releases those chemicals. It's like you said, no one on that board has put they want to take a pill, right? Yeah, no one wants to take a pill. Well, this is it. This is the alternative. The alternative is get those chemicals for free. Your body is designed to make them. Your body is designed to move. Okay, constant movement. We talked about learning. So Dr. Raj talked about SHIELD, and the L stood for learning. Okay, so he's absolutely right. You can teach an older dog new tricks, absolutely. It's called neuroplasticity. Now, back in the day, they believed that our brain stopped. We were unable to grow new brain cells after the age of 25. Basically, you were stuck, and that's where a lot of these labels came from around mental health. Nowadays, neuroscience is proving otherwise. It's called neuroplasticity. This is our ability to be able to grow and to learn. Now, what that basically means is that as we get older, we are able to learn new things. It just means we have to work a little bit harder at it. That's the part that I think a lot of people struggle with. We can learn, but to enable that learning, physical activity can really help you with the brain signaling, because when your body can do things, it actually encourages the mind to work as well. So the two are absolutely linked. So when it comes to learning, physical activity, and I say this to all, because I worked in schools for 2 years as well. I said this, I worked with a lot of exam students that just before their exams, I recommended doing physical activity. And guess what? All of them perform better in their exams. So if you've got kids that are coming up towards their exams or tests, physical activity, 5-10 minutes just before their exam, promise you it does help, because it releases the neurochemicals in their brain. They say 30 minutes of moderate exercise several times a week. So anyone got like apps on their phones? Yeah, what gets measured gets managed. Anyone heard that phrase? What gets measured gets managed. I've got a Fitbit. One of my areas of health that I'm working on, I'm not perfect, is sleep. We talked about sleep and how important that is. They say that if you want to know how well somebody is, don't ask them how are you, ask them how well do you sleep. That'll tell you how well they are. Okay, so sleep is absolutely crucial, and I use my Fitbit to measure my sleep just to give me some kind of trajectory. Not to get obsessed or focused on it, it just gives you a trend upwards or down. It tells you where it's going. So I would massively recommend these tools are there to make our life easier, they're to help. Use them. 30 minutes a day, that can be housework. Who in this room that doesn't do housework? Yeah. So when you got the Hoover out, put a bit of music on, do it a little bit harder. There you go. You've just done a high intensity workout. Woohoo! It doesn't have to be difficult. My job is to make this accessible to absolutely anyone. You don't have to go to a gym. You don't even have to come to a class. It's great if you do, but you can do it in your own homes. It's accessible to absolutely everybody. Okay, we talked about rest. Regular movements helps improve the quality of sleep. A lady asked in the audience earlier about sleep. So a little bit of science again. In the morning, we have a rise in our around 3-4 o'clock. Cortisol comes into our blood. That's meant to, back in the days when we were hunter-gatherers, it encouraged us to go hunting and gathering, so it got us all stressed and getting ready to work. And then when darkness fell, that then stimulated a hormone called melatonin. Okay, circadian rhythms, which is a rhythm of our body, are very, very important for overall health. Every single cell in our body has a rhythm and a circadian rhythm. Unfortunately, modern day life is basically working against that rhythm, which is what's causing all of these illnesses and all of these conditions. So when it comes to sleep and physical activity, what you want to try and do is you want to try and do your physical activity before 6 p.m. and finish by about 6:30 p.m. and try to go for more restful activities past that period, okay? And also looking at lighting, again, having bright lights, TV, phones, all of these things, it suppresses melatonin and increases cortisol, which then again affects the quality of your sleep. So sleep is an absolute crucial part of your physical. It is a physical activity of the body. What it does, it clears out the system. It's I want you to imagine, just like, the dustbin men come round on a certain day of the week. Mine is a Thursday. What day is yours? Yeah, okay. Well, your body's dustbin men come every night, all right? But they only come when you're asleep. So if you're not sleeping well, guess what's not happening? It's not been cleared out. Your system is not being cleared out. So I want you to imagine every single night, in order for we all know what happens when the dustbin men don't come. It's Christmas, and we're all thinking about, oh, blooming heck, hope my rubbish is going to be taken away, because it starts overspilling and things things aren't good, right? So that's exactly what's happening when you're asleep. So very, very crucial, very important. Dr. Raj, you talked about inflammation. The brain can lead to depression, brain fog, and cognitive decline. Movement helps lower inflammation, boost brain health. Physical activity triggers autophagy. Autophagy is a way of clearing out the bad cells and keeping the healthy cells. So autophagy is also something that happens when you exercise. It happens when you fast. So these two things are the body's natural defense mechanisms. Don't forget, millennia ago, as we've evolved, we didn't have the modern technology. Our body actually has everything that it needs to be able to do what it needs to do to be healthy. You just need to tap into your body's natural systems. Autophagy happens during sleep, it happens during fasting, it also happens during exercising. It clears out the bad and keeps the good and makes it healthy and strong. So short bursts of exercise. In fact, today, if anyone watched the news, they were just saying that Parkinson's disease, high intensity exercise has been proven to support Parkinson's disease as well. So we're seeing this it's an evolving field. We're learning every single day how important physical activity is to the brain. So that was the last kind of quote that I was going to leave you with. Exercise is the most transformative thing you can do for your brain today. It's like fertilizer for your brain, enhancing cognition and protecting it from decline. Do what you can. Start now from where you're at. That's all I say. All right, thank you guys.
See, I just want to say how life has shaped you into a wonderful, caring, beautiful and big humanitarian. I mean, your story is gut-wrenching, heart-wrenching, but you've actually come out of that amazingly well. So big round of applause to you.
Away during COVID at Laros. I've been fundraising for Laros ever since. I'm going to be running the London Marathon, which I've not announced yet, for Laros. So Santosh, I'll share the page with you if you can share with me.
I will share that with everybody. I'm just a very... Hardik, are you here? There you are. Hardik, come to the front. So Z is actually one of our personal fitness trainers here at People Centre, so you can actually join her classes. She's got amazing moves, as you saw, and you could actually have those amazing moves if you just come to her class. You can pick a leaflet down from front of house downstairs. Oh, sorry, yes, I've got a wave at the back there. We've got leaflets on the People Mental Health Care Cafe, and also the sports and health well-being. So I'm going to introduce Hardik, who's also one of our People's Fitness instructors. And when I asked him last week if he could just give us a sort of rundown as to what else we do, he said, "But I've never done anything like this before." So he has, bless him, has actually spent some time putting it together. Be kind to him. He is going to tell you what else he does and what we do at People Sports.
Good afternoon, everyone. As we gathered today for World Mental Health Day, I want to emphasize the critical link between physical activity and mental well-being. Physical exercise has been proven to reduce symptoms of anxiety, depression, and regular workout can boost your mood and even improve your sleep quality. These all are essential components for mental health. At People Gym, we understand that taking care of your body is a powerful way to support your mental health. People Gym is located right here in Leicester at People Centre, offers not only mixed gym but a dedicated ladies gym only, making sure everyone feels comfortable in their journey towards better health. We offer a wide range of group classes such as yoga, cardio, abs, ladies only batches like Zumba by Z and dumbbell circuit. These all activities that combines of fun and fitness. And we have special discounts to make mental and physical wellness accessible for everyone. If you have any questions, feel free to speak to me, and if you want a Zoom tour, I'll be at downstairs reception. Thank you.
Thank you, Hardik. That was tremendous. We now move on to the speed dating bit, which our host Sharon is actually going to take us through. I'm going to hand over straight to you, Sharon. You can pick it up from here.
Okay, are we ready? So we're going to do speed stall dating. We've slightly changed the name. We've moved it up. So what we're going to do, I'm going to give all the stall holders about 30 seconds to have in their head what they're going to say. I think we're going to give each other about a minute. And in that time, the stall holders are going to promote themselves, a bit like speed dating, not that I've been on, that they're going to promote themselves, what they offer, something that might be interesting for you or someone you might know that might need it, and then we'll go round. And at the end, if there's any questions you want to ask, we can go for them. So, are we ready? Yes. Are we starting with Live Well? I'm going to, because they gave me a sweet earlier. I needed it for my mental health at that moment. So, I need the mic, not that I've ever needed a mic because I'm loud enough. Live Well, who've we got? Dale.
And Billy.
And Billy. Dale and Billy, come on, give a round of applause. Are you Dale?
Yes.
Dale, over to you, go.
Hello everybody, me and Billy work for Live Well and we are part of Leicester City Council, and our job is mainly to provide the people in Leicester with a health and well-being service. So we like to help people be more physically active, and we like to help people reduce their alcohol intake, as well as helping people to quit smoking.
Oh, that was a pin drop.
Have you got any more questions for me?
Have I got any questions? No, I feel like no, I haven't got anyone got any questions for Live Well. So they're helping with smoking, drinking, there's some sweets there. There's the jars, what are the jars?
So these jars that we've got on the table, they just show you what's happening to your body when you are smoking, and it's important that smokers are aware of this to give them a bit of motivation to make that right decision. And in terms of smoking, what we do is we offer people a 3-month we offer them a 3-month plan where they get access to free nicotine replacement therapy, as well as getting behavioural support as well. So it's a really good service, and to be honest, there's never been a better time to quit smoking, because there is a lot of support available at the moment. So if you know anybody who smokes and you think they should stop, kindly push them towards ourselves. Just go on Google, search Live Well Leicester, you can self-refer, and we'll be happy to help as many people as possible on that journey.
Can we give it up for Dale, please, and Billy? They are on Google, Live Well, so if you want to live well, then contact them. Okay, next we have Gumcare, and we have Adrian. Right, okay, so your time starts now. There's free pencils and pens, by the way, here. It's not like working at a school where there's no supplies.
Everyone, I'm Adrian, so outreach engagement practitioner for Gumcare East Midlands. So we're a gambling support charity to help anyone struggling with their gambling or someone else's gambling. So you can refer to us online, you can fill out the referral form as long as you're 18 or over, so we support families as well impacted by someone else's gambling. We are a free charity, so there is no waiting list as well into our services. So we offer cognitive behaviour therapy, so it's just talking therapy around behaviour change, so it'd be CBT if anyone is familiar. So, yeah.
Thank you, Adrian. And I know, I mean, I'm sure someone's been here to the casino in Leicester once or twice, and it is heavily Asian populated. There are a lot of gamblers out there. Right, on the next table we have our very own people mental health, and I think there's a fight of who's going to speak. Obviously they didn't ask me to speak because I clearly have no problem speaking. And we're going to have who? Don't all wish at once, ladies. Okay.
Hello everyone, I'm Angela. I'm the neighbour lead for the City East area, so I work for Leicestershire Partner for NHS Trust. So we fund with the ICS the mental health cafes. We have about 25 across Leicester and Rutland. The one in the People Centre is in the People Centre, the People Mental Health Cafe. They do an amazing job. One of my roles is to connect all the organisations that support somebody in terms of their mental health and wellbeing together. So I work with a lot of professionals, but I'll hand over to the People Centre so they can give us a bit more information about what they do.
Thank you everybody, my name is Bhanot. I'm one of the senior recovery workers for our People Mental Health Cafe downstairs. We run that every Wednesday from 2 o'clock to 7 o'clock, so if anybody that does need support, just wants someone to reach out, please do come and see us. We're normally based downstairs, so if you do want to come and see us, please do. There are also quite a lot of other cafes that are available, over 25 all around the city, so if you do want to find something that's closer to your area, please do come and see us and we can give you a little bit more information about the cafes that are available. Thank you.
Thank you, ladies.
A lot of stores here that we are connected to. For example, Sharma Centre, Live Well, like yourself. We've just got the contract for the smoking bit, so we start them off and then refer them on to you. Bit like yourself as well, Marla. However, I just wanted to say, Turning Point is a large organisation here in Leicester. It's Leicester, Leicestershire and Rutland, and we work with addictions. So we have our psychiatrists up there to going all the way down to recovery workers and support workers, and our organisation encourages peer mentors, people with lived experiences. I just wanted to say also that recovery from addiction doesn't just start with clinical treatment. It's also about working with people in a psychosocial way. So a lot of these things that have been said here, they do apply to when you're working with people in a psychosocial way as well. So yeah, I just wanted to say it's been nice being here with you all, learnt a lot and hope to come back again. Thank you.
Do we have Marla? Yes. Marla, over to you from Sharma Women's Centre.
Hello everyone, so I'm the Training and Development Officer at Sharma Women's Centre and also the Peer Support Recovery Worker. So I'll tell you a bit about both those roles. So it's in relation to gambling harms within the minority ethnic communities. So not only if someone is gambling themselves and is suffering with harms themselves, but also has affected others. So if you're, either a spouse, a friend, a colleague. We work in partnership with Turning Point and GamCare in Corner. And we're trying to raise awareness. So part of my role is going out and speaking to community groups. I'm not speaking Gujarati today, apologies for that, but we can come and talk in Gujarati, Punjabi, Urdu, multilingual staff within the centre. So it's raising awareness around that and also going out to organisations and training their staff, key workers, volunteers, to be able to have those conversations with clients coming in. Basically, we provide a service that's safe and trusted. We don't judge you. If you come and speak to us about something, the main thing is that we want you to know we're proud of you for taking that first step, for reaching out for help. So it's spreading the message, talking to our friends and family and getting that awareness out there. That's a bit about the Gambling Project. I'm going to very quickly and not take up this mic for too long, but tell you a bit more about what Shama does. So we do a lot of therapeutic holistic classes, so sewing, baking, cooking, hair and makeup, and I know that seems all female orientated, but we support men with welfare rights and counselling too. That applies to both men and women. We have an on-site nursery. We can provide support with filling forms, languages, etc. So we've got a whole array. We stand outside, so if you're interested in more of the wider services, please come out and pick a leaflet on your way back. Thank you all for your time, and lovely being here today.
Any points. Jamila's legacy. Have we got anyone from Jamila's legacy? Come on, Sound of magic. What's in your hand?
Good afternoon, everybody. I'm Rohana Siddharth, founder and CEO of Jamila's Legacy. We've got a stall out there. Thank you to People Centre for inviting us today to this amazing event. We are a mental health organisation. We support and educate communities and organisations in mental health wellbeing. We are open to anybody. You don't have to be somebody who has a mental health problem, because we believe in prevention and early intervention. And like the psychiatrist said, both of the psychiatrists said earlier, that it's really important we take ownership of our mental health and our mental well-being. So we encourage you to take an interest in your mental health. Come along to any of our services that we offer. We also, like the People Centre, run some of the mental health cafes in Thurnby Lodge and in Highfields. So drop in or give us a call if you're struggling or you need a chat, because sometimes loneliness is one of the major factors that can impact our mental health. So just being able to talk to somebody is really important. We have a team that speaks Gujarati, Hindi, Punjabi, Urdu, so come along and talk to us. We've got a women's project, we've got a cancer project, we've got the young people's project. Pick up the information from our stall, go onto our website, and you'll find out all the details. Thank you very much.
Have we got, no, that wasn't Health Watch, have we got Health Watch? Yes. I'm trying to go by order just so I don't miss anyone. Health Watch.
Sorry, I'm really nervous. My name is Shireen, and there's still now an interview. I've got 2 volunteers. So we are actually everybody's friend and critical friend with NHS. So we really need to hear about your voice about health and social care services, what service is going well, what's not going well, and we have, the Health Watch have the power actually to share the information with NHS leaders and commissioners and make sure they listen to your voice and improve the care for everyone. We also have volunteering opportunities, and our volunteering opportunities not from 9 till 5. You can choose your hours if you want to give us any hours. We have a volunteer opportunities for entering view officer, community network, that's what we're doing today, or for our board members. So if anybody's interested to become our volunteers, please come and see us. We've got the volunteers officer here today. She can give you more information. And please come and see us. And we also go around all the community centres. Part of my job is to hard to reach communities, and I think everybody early on they're speaking, they just, we are not hard to reach. I always go out to everywhere, and everybody says to me, Shirin, you're everywhere. But I feel that this is the way I can actually engage and capture your voices and share it with the NHS leaders and commissioners who makes the decisions for the care, to improve the care. Thank you very much.
Okay, diabetes self-care help group. I like this. This year everyone's prepared. The first year we did it, it's like I dropped a bomb. They were scared. Have we got diabetes self-help group? No. Okay. Wesley Hall. Have we got Anita or Amina from Wesley Hall?
At our community centre we offer a wide range of services from the elderly to under 5s. We also have a day centre and also a preschool. So we have lunch clubs for the elderly as well. We also have different activities like English classes, all ESOL classes as well, maths classes. We also won Charity of the Year award. So please check out our stall outside. We offer a lot of free services, so we can't really put that into 30 seconds. So please visit our stall. Thank you.
Okay.
Hello everybody, my name is Umakant Reddy. I'm from Heritage Healthcare. We provide care services to the vulnerable people, particularly elderly and people with disabilities and all. So we are a CPC registered provider, operate in the Leicester and the Leicestershire area. So yeah, I think we help the customers to live independently and live with the dignity and all. So yeah, if anybody interested in your community would like to care services, please contact us. If anybody would like to work for us as a carers, yeah, we're very welcome to contact us. Thank you.
Thank you. Now I know Spinny Hill Drugs is here because Alibi.
Hello everyone, welcome. My name is Abdul Alibi. First and foremost, I would say I'm a recovering addict. Welcome to Spinny Hill. I just want to quickly read out who we are, what we are about. So Spinny Hill was established about 7 years ago. We've come a long way, and we've actually working very hard to help those people who are in misuse of substance. So basically what we do is obviously we have a program. We open 5 days a week, Monday to Friday. We open from about 11 o'clock till about 5:30. We have training for the people in the community. We give them training, and also other organisation. At Spinny Hill, we believe that human beings are made up of 3 components, parts: the body, the mind, and the soul. Okay, these 3 component parts, it will be very difficult for an addict to make a sustained changes. Okay, so drug addiction is something where, very importantly, there's 2. When a person who are using drugs, okay, 2 things. First is the addiction part. Second is the characteristic. Okay, so the person's got to work on the addiction part of it, gaining knowledge, help with the professionals out there, the counsellors, the psychological effects that they have on them, so they need help on that as well as the characteristics. So when a person is on substance for X amount of years, 15, 20, 25 years, yeah, the characteristic changes. How are you going to put that back together? You're going to have to connect to your higher power. We all have a higher power. It's either human being, Allah, God, Bhagwan, whoever it is. Okay? So we need to connect to that. And without that, it's not going to work. Okay? You need both. You need the education, your addiction part to help you recover, as well as your higher power. Okay? So now with Spinny Hill, like I said, we would like everyone from the community, to come to Spinny Hill. Just come, have a look. We'll have event day. We can organise event days there. We also work with Turning Point, Sister Sumaya. She comes along, she delivers the programs. We have Shama here, we have other organisation that comes along, So it's very important that we kind of, help each other. Don't just leave them alone. Because I've been through it. I'm a recovering addict, so I can understand an addict. You see, I got sent to South Africa, for my rehab. Okay, the youngest child to come there was 6 years on crack cocaine. Okay, the second youngest child to come there was 7 years on crystal meth. So drug does not look at who you are, what age, what religion, what background, what gender. It doesn't. What creed, it doesn't. Okay, but we have to help. We are serving the humanity for the pleasure of God. Thank you very much.
Thank you. And unfortunately, the drug misuse and alcohol misuse is hitting young age onwards, so it is really important. And have we got Mumtaz or someone from Womenton CIC? Yeah.
Thank you.
Hi everyone, I'm Mumtaz from Momentum CIC, and I'm just going to read out to you so I don't miss anything. Please bear with me. So, we offer a Zen Connection, a support group for women. As a woman, you're a mother, a daughter, a sister, a friend, and a colleague to everyone, but usually face daily battles alone. I think we can all relate to that, right? We are a peer support group for life problems. I am personally a part of the Community Leadership Network, and I am passionate about breaking social inequalities in health and well-being and breaking taboos in domestic abuse in the South Asian community from lived experience. We collaborate and signpost to local cradle-to-grave services, and we work alongside Cynthia's Trust and Leicester Nirvana Football Club. Thank you for listening.
Thank you. Now we've gone back to Diabetes Self-Help Group. We've got Sonali. Thank you.
Hi everyone, good afternoon. I'm Sonal Bhavsar. My main background is I'm an Ayurvedic doctor, and I set up the Diabetes Self-Help Group in 2012. So for 13 years on, we want to help and support people who are diabetic. But last 7 years, we are involving non-diabetic as well, because it's all about self-management. Diabetes is the condition that you can self-manage, as well as you can look after your mental health quickly. So long-term complications, we want to avoid it, and lots of health problems, we can avoid it with the diabetes self-management. And also any other health condition you have, you can do self-management, a little bit of something from your side. We meet 4 times a week in the Belgrave area, and it's like a coffee morning, and we do gardening, we do socializing, and we do lots of activities. We have got professionals coming in, such as China, doctors and nurses. So we want to help people in Belgrave, or whichever area you are from, you are all welcome. You can contact us from the website as well, www.diabetesselfhelpgroup.co.uk. And you are welcome. I'm around here. If you have any question about our group, you are welcome to ask. Thank you so much.
Thank you, everyone. Now, just a reminder, if you go to their store, they have a lot more information. There's leaflets to take home with you in case you forget. There's the contact details. On this store behind me, there is a questionnaire. Please go and fill in the questionnaire, feedback, and there's also a registration form as well.
Just a couple of points before I conclude. Feedback questionnaires was mentioned. We have some for stands and some for audience. We have been recording today, and we do plan to put the recording on YouTube. If anybody has an issue, please come and talk to me about that afterwards. And then, really to conclude, I hope you found today valuable and enjoyable and learnt something about health and mental health. I'd like to thank our speakers today, Dr. Fabida Arya, Dr. Nij Singh and V. Rachna Vyas, Chief Operating Officer and Deputy Chief Executive as NHS Leicester, Leicestershire and Rutland Integrated Care Board, and Councillor Manjula Sood, MBE, Deputy City Mayor for Leicester. I'd also like to give a big thank you to my steering team for this event. So we've had Sharon as our wonderful host, Shivana, Sandhya, Maya, Piki and Raj, who put all of this together with me. So they've done an absolutely wonderful job. And I'd also like to thank the People Centre staff, because they are in the background, but they do a lot of the running around here too. A thank you to the NHS and of course you, our community and independent health partners who have held stalls today, and we look forward to working with you again. And a thank you to you, our participants, and hope you found today informative. And finally, a thank you to our sponsors, Ethnic Inclusion Foundation, who is the parent of People Centre, and also Leicester Community Foundation. So with that, we're going to conclude. We have a fabulous lunch laid on for you, and you can do some more networking. So thank you very much, everybody.